This is Precious Anderson. She was pregnant.
Did you have a name for the baby?
About 2 months before her due date, she had severe COVID-19. Actually so severe that her baby had to be delivered by C-section to try to save both of their lives. In fact, she couldn't actually visit her baby.
There you go, Precious.
And then it was amazing because we got to watch her video chat with a nurse who was with her baby. And Precious Anderson got to see her baby, David.
Wonderful, right?
We actually went to visit him, and he was moving around, he was stretching, pointing his toes like a little dancer. He was so cute. Actually, he tested negative for COVID. At this hospital, 7 of the pregnant women who tested positive for COVID have given birth, and their babies have generally done very well. None of them have been confirmed to have COVID. I'm Sherry Fink. I'm a correspondent at the New York Times. For the past several weeks, Victor Blue, a photographer, and I have been able to spend time at the Brooklyn Hospital Center. And for the story published this week, we spent time with pregnant mothers on maternity and in the intensive care unit.
What we're finding out sometimes is that a patient comes in totally asymptomatic and starts to have symptoms in the postpartum area. We had a couple of those over the weekend.
Dr. Errol Beyer is the chair of obstetrics and gynecology. And he said that this moment, which should be such a joyful moment in a family's life, bringing new life into the world, that in fact now it's anxiety-provoking.
How you doing?
What struck me was people doing the typical things you would do on a maternity ward, but doing them with masks, with face shields, with gloves, with gowns.
And I'm going to put her on the EFM machine, monitor the baby, the heartbeat of the baby.
Many of the staff members on the maternity ward and in the neonatal ICU are out sick. So there is a level of fear. Bashery McKenzie was also on the intensive care unit, and she's pregnant, and she got very sick with COVID. She was so afraid, and of course it's really hard because you're alone. You can't have any visitors.
I just look at them on my phone every day and just try to pull through.
When I met her this Monday, she was so much improved.
My 3-year-old daughter keeps me going.
And she was able to continue her pregnancy.
Your respirations are pretty okay. Okay? Very good.
So there are a lot of very sad stories with COVID-19 of people in the intensive care unit, many of them not making it. So it was amazing to see this young woman who had been so sick was able to pack up her bags and actually go home. And she's one of the success stories.
You made it. You're telling a great story, honey. We're proud.
You gotta have heart, and you had it, so we're very proud of you.
Thank you for allowing us to take care of you.
I spoke with the intensive care unit doctors, and they said when people like Ms. McKenzie get to leave the hospital, get to come off a ventilator, out of an intensive care unit, and recover enough to go home, that it's giving them the energy to keep going.